Ayan, yay! Thank you so much, Aid. So, of course, we've been hearing about yung mga ginagawa ng certain types of immune cells para malabanan ng anumang offending agent in acute inflammation. Pero, of course, knowing the cells involved is only half the battle. Sa sobrang laki ng katawan ng tao, mahirapan silang makarating sa site of infection kung wala ang mga tagatawag sa kanila, ang mediators of inflammation. These are substances na pwedeng galing sa cells mismo or galing sa proteins na nasa plasma na nag-initiate at nag-regulate ng inflammatory reactions. Sa slides, isang table lang ang pinakita ni Sir. So for this podcast, bigyan lang natin ng onting need to knows yung major mediators. And nilagay ko lang din dito ang mga gumagawa ng mediators na to, which include mast cells, macrophages, dendritic cells, neutrophils, platelets, endothelial cells, and the liver. So first, we have histamine, which is probably the most common mediator na maririnig in association with inflammation, lalo na sa mga kasama kong maraming allergy dyan. So, hindi natin bestie si histamine. Anyway, histamine is produced by mast cells, basophils, and platelets. And ang main functions niya ay vasodilation and increased vascular permeability. Then we have two major arachidonic acid derivatives na produced by mast cells, macrophages, and endothelial cells. You can actually differentiate these derivatives by the enzymes that produce them and yung major functions nila. So for prostaglandins, the enzyme is cyclooxygenase, while for leukotrienes, it's lipoxygenase. So madaling tandaan, leukotrienes, lipoxygenase. So LL. And then kung hindi yan yung nasa tanong, edi yung kabila yun. So for functions naman, tinatandaan ko lang talaga na P is for pain and prostaglandins. Tapos dilation, glandins. Oh my God. Basta P and D. Kaya niya na yan. For leukotrienes naman, remember na leukotrienes. So meron siyang tatlong major functions. Smooth muscle cell contraction, increased vascular permeability, and chemotaxis of neutrophils. This is very important. Leukotrienes ang isa sa mga mediators ng pag-adhere and activate ng neutrophils. So, aside from chemotaxis, kasama din sila dun sa important mediator sa leukocyte rolling ng neutrophils. Then, we have ang dakilang cytokines na too many to memorize. Kaya dito lang tayo sa top 3 cytokines na laging bibo. And if may tatandaan kayong tatlo, tandaan nyo na ang pro-inflammatory cytokines na si Harry, Ron, at Hermione, aka IL-1, TNF, and IL-6. Thank you so much. Shout out kay Sobhagay para sa meme na to. And like the arachidonic acid derivatives, mostly galing sila sa mast cells, macrophages, and endothelial cells. Pero sa true lang, marami talagang cells na gumagawa ng cytokines. Very important yung tatlong to sa local and systemic inflammation, as you can see in this diagram. Pero I won't go into it na kasi nandito na rin naman siya. And that also means na makikilala natin ulit sila pag na-discuss ko na ang systemic effects ng inflammation. So before we move on, we'll also talk about chemokines. So ang chemokines are actually a subtype of cytokines. Alam ko medyo nakakalito yan. Nung undergrad din ako, very confused ako kung magkaiba ba yan, pareho ba yan, whatever. Pero yes, chemokines are a type of cytokines. And ang main function nila ay chemotaxis. So ayun, madali nang tandaan yan. Chemokines, chemotaxis. Ang main job nila is to attract and bring immune cells towards the site of infection. Tulad nga nung pinakita ni AIDS kanina sa leukocyte rolling. And then we have yung complement system, which are actually plasma proteins na ginagawa sa liver. I know parang seemingly random yung combination ng numbers and letters dito, but it's really based on paano sila nabuo. If you're really interested, you can actually check out yung 3 pathways ng complement system sa Robbins kasi super detailed yung explanation niya doon. Pero if naghahabol ka rin ng oras for the exam, for now, it's important to remember these 3. Pero actually, in terms of acute inflammation, ito yung isa sa ito yung dalawa sa pinaka-important. C3 and C5. So, yes, parang yung kalsada para sa mga familiar sa inyo. Tapos, pareho silang may A. So, C5A, C3A. Important sila for leukocyte recruitment and activation. So ayan, I have included here the same table lang na binigay ni Sir sa slides to summarize the main mediators ng acute inflammation. Okay, so we're now gonna talk about yung outcome ng acute inflammation bago natin siya tuluyang iwanan. So let's just go over this quickly. Based on this amazing diagram from Robbins, acute inflammation usually occurs in these types of injuries. So after all that, what happens next? TBH, you can think about it like fighting in any type of relationship. Okay, relationship 101 tayo dito sa patho. Kapag sabihin natin yung injurious agent mo is yung cause ng away. Tapos, there are actually three possible outcomes. Una is magkaroon ng resolution na mapag-usapan nyo at masolve ng maayos yung problem, coming back stronger, ganon. But you can also have fibrosis na okay, yeah, natapos nga yung away, kaso nasira yung relationship. Baka sobrang lala nung mga binitiwan ninyong salita sa isa't isa that there's no way that you have a functional relationship even after mawala yung problem. Charot. Anyway, and then there's also chronic inflammation na nangyayari pag hindi mawala-wala yung problem. Hinayaan nyo lang. Baka hindi nyo napag-usapan or for some reason hindi siya na-resolve. Kaya habang tumatagal, lumalala yung away. Ayan. Okay. So, ganun din yung acute inflammation. It has three possible outcomes. So, again, real quick, yung resolution, yung fibrosis, and yung chronic inflammation. Pero, take note na based on this diagram din, ang chronic inflammation is not always a cause. It doesn't always come after acute inflammation. Pwedeng it develop on its own given these types of injuries. And since napag-uusapan na rin naman natin ang chronic inflammation, I'll segue into it. Chronic inflammation, in contrast to acute inflammation, is actually a response to persistent infections, hypersensitivity, and prolonged exposure to toxic agents. And usually, makikita natin sa type of inflammation na to, yung balance between tissue damage and repair. So, ito naman yung signs na kailangan mong makita to conclude na chronic inflammation ang nakikita mo sa tissue sample. So, for chronic inflam, meron tayong tatlong hallmarks. AIDS. Char, hi! Tanong ko ita ulit and the audience. Ano nga ulit yung 5 hallmarks na naka-SpongeBob meme kanina sa slides mo for acute inflammation?
Redness, warmth, pain, loss of function. I am forgetting another, which is
swelling.
Swelling.
Yes, correct. And histologically, kapag nakita mo yung hallmarks na yun, you'll actually expect to see vascular changes, edema. This is foreshadowing to our next episode. And mostly neutrophilic infiltration. So remember that. Neutrophilic infiltration kapag acute. So in chronic inflammation naman, mononuclear cells na ang nag-infiltrate instead of polynuclear cells like neutrophils. So this makes sense kasi neutrophils have a much shorter lifespan than macrophages. So of course, if matagalan yung bakbakan, kasi nga ang chronic ay persistent stimuli, syempre, you'd expect to have more of these cells na kaya makipagbakbakan ng mas matagal din. Bilangin nyo lang kung ilan yung lobes ng nuclei ng cells na nakikita nyo, then you can determine if chronic or acute siya. Tulad nung nandun sa video na binigay ni Sir for this lecture. Pero tulad nga nasabi ni Washington DC, doon nga sa video niya, it's possible for poly and mononuclear cells to coexist actually in the same sample. So, ang kailangan mo lang tingnan is yung predominant type. Then we can also see tissue destruction sa chronic inflammation na it means na hindi na siya as organized as yung original architecture niya. And most importantly, pinalitan na ng connective tissue yung damaged tissue mo. So, for this slide in particular, don't worry if hindi nyo makita ng maayos yung hallmarks kasi may mga naman tayong magdi-discuss later ng in-depth histo lectures. Okay, so like acute inflam, chronic inflam also involves a lot of cells na pinipilit na malabanan ang persistent injurious agent natin. So if you remember, yung 5 R's ng sequence ng inflammation na diniscuss ni AIDS kanina, we can still see that here. So now, Kaya ang laki-laki nitong macrophage natin kasi sila talaga ang bida ng chronic inflammation. Not just dahil sila yung involved sa bakbakan with the injurious agent, but also because ang dami kasi talaga nilang ginagawa. Bibong-bibo po ang macrophages natin. So una sa lahat, antigen-presenting cells sila or APC. So bale, they can phagocytose yung injurious agent para makuha nila yung antigen na ipapakita nila or ipipresent, kaya nga siya antigen presenting cell, na ipapakita nila sa lymphocytes, aka yung B cells and T cells mo, para ma-activate sila at magparami to do their thing. For B cells, essentially making antibodies, and for cytotoxic T cells, killing infected cells. Meron din namang helper T cells that can also produce cytokines like IL-5. Sabi sa inyo, di ba? Like, ang dami talagang klase ng cytokines and ang daming cells na kaya mag-produce sa kanila. Pero, yeah, if you're gonna remember top 3 for inflammation, it's IL-1, IL-6, and TNF. Anyway, yeah. So, yung helper T cells natin pwede ring mag-produce ng IL-5 para magtawag ng eosinophils just in case na parasitic infection yung meron. And then, hindi lang T cells ang kayang tumawag ng leukocytes. Actually, isa pa yan sa kayang gawin ng bibong macrophage. And of course, sila din ang kasama sa bakbakan by engulfing yung injurious agent and destroying them. TBH, maraming overlaps ang roles ng cells na to, all of these cells. Pero yung listed lang naman dito, yung main jobs nila. Siyempre, mahirap intindihin yung sinabi ko kanina na puro words lang. So let's take a look at this diagram. Una, we have this APC or antigen presenting cell na pwedeng macrophage, pwedeng dendritic cell, ganun. Kasi nga, they will phagocytose yung injurious agent, break it down to get the antigen na ipapakita nila dito sa lymphocytes like helper T cells. So, alam kong helper T cell siya dahil CD4 plus yung meron siya. CD4 receptor yung meron siya. Itong helper T cells na to ay magtatawag ng leukocytes and tutulong mag-activate ng circulating monocytes para maging macrophage. So, ayan. Magre-release siya ng cytokines para magtawag ng leukocytes and magre-release siya ng interferon gamma para ma-convert natin ang circulating monocytes into an activated macrophage. Ayan. And here, we can also see the 3 big jobs ng macrophages. So, of course, there's this antigen presentation nga to the T cells. Tapos, kaya rin niyang mag-produce ng cytokines para magtawag pa ng other immune cells. And of course, makipagbakbakan sa injurious agent. Eventually, if matagal nang activated ang macrophages, pwedeng magkaroon ng granuloma formation, which is actually a collection of cells na ang main goal ay makontain ang injurious agent at wag na siyang maghasik ng lagim elsewhere. Dito, makikita natin yung activated macrophages na nakikipagbakbakan. Tapos, eventually, matatransform sila by lymphokines, which are basically cytokines, and magiging epithelioid form na sila with an abundant cytoplasm. Eventually, these cells will fuse with each other and then makakagawa tayo ng giant cells. So, itong giant cells na to ay multinucleated kasi ang macrophages natin ay mononucleated, di ba? So, it's essentially one nucleus plus another nucleus and multinucleated. Yay! Pero, don't confuse this with neutrophils na polynucleated kasi while pareho silang more than one yung nucleus, yung pagiging maraming nuclei ng giant cells is because of fusion ng epithelioid macrophages. Yung neutrophils, on the other hand, they were born that way. So, poly na talaga sila from the very start. Ayan. So, there are 2 types of granulomas based on what caused the formation and whether or not may lymphocytes silang kasama. So, sa hypersensitivity na type ng granuloma, they're caused by agents na kayang mag-induce ng response from lymphocytes. So, pag nakita ka ng granuloma na may lymphocytes, it's more likely na it's caused by an injurious agent na nag-induce ng lymphocyte response. On the other hand, kabaliktaran naman sa non-hypersensitivity type ng granuloma, it's caused by inert foreign bodies like talc. So, hindi nila kayang mag-induce ng lymphocyte response. So, kaya yan yung klase ng granuloma na meron sila. And of course, in addition to the activated macrophages and the giant cells na makikita natin sa granulomas, they're actually surrounded by lymphocytes and fibroblasts. Okay. So ayan, we have hinted na before na ang inflammation, hindi lang naman siya confined sa local area kung saan nangyari yung infection. Because immune cells produce messenger molecules like cytokines para magtawag ng reinforcement. So, ayun, may systemic effects din ang inflammation. So, there are actually 3 effects na caused by the Harry, Ron, Hermione of cytokines, which are, again, IL-1, IL-6, and TNF. Dito, may kasama na rin silang interferon. So, siguro dagdag natin si Neville. Ganyan. Okay. So, the Harry, Ron, Hermione, and Neville of cytokines. Okay, so first we have fever, which is an increase in body temperature caused by pyrogens. So, fire, mainit, fever. Oh ha, yes. Yung pyrogens na yun are actually IL-1 and TNF. Then we also have leukocytosis, which is an increase of circulating leukocytes, which is a given since ang purpose nga ng cytokines ay magtawag ng leukocytes. So, syempre, dadami yung leukocytes mo na nasa blood. And last, we also have an increase in plasma proteins, like the complement proteins na kalsada like C3A and C5A. Of course, like acute inflam, hindi naman nakikipagbakbakan forever ang cells natin. Eventually, they will either eradicate the stimulus, tapos makakapag-repair ng maayos, like here in healing, or if hindi talaga kaya dahil hindi matanggal yung stimulus and yung nire-repair nung katawan nadadamage lang din ulit, eventually pwedeng ma-overwhelm yung repair process causing ulceration and eventually perforation. And syempre, we don't want that. So, tamang segue lang to tissue repair, which refers to the restoration of tissue architecture and function after an injury, which is very important for the survival of an organism. Meron siyang 2 main processes, regeneration and scarring. For tissues na kayang mag-proliferate or with a stroma or parang base na intact pa rin para pwedeng mag-proliferate yung cells doon, regeneration ang nangyayari since pinapalitan mo basically yung mga nawala or nasirang cells with the same type of cells na nawala. And kayang gawin ng katawan yan with the help of growth factors na galing sa macrophages and sa cells within the area. So, the tissue will go back to normal and functional pa rin, like how in this GIF, para sa mga Whovians dyan, si 10th doctor na nag-regenerate into 11 is still a functional doctor kasi hindi siya namatay. In the body, this is seen in liver cells. So, if nagkaroon ka ng partial hepatectomy, yung natirang hepatocytes mo will actually receive signals from macrophages, tapos they can divide and replace yung mga nawalang hepatocytes. So, in the case naman ng mas malala, yung damage, yung liver, actually kaya pa rin niyang mag-regenerate with the help of progenitor cells na kayang mag-differentiate into mature hepatocytes. Pero, unfortunately, not all organs have this luxury. If the damage is too much, spoiler alert, like yung nangyari kay Ang dito sa Basing Say, na tinamaan siya ng kidlat, kahit pa may kakayahang mag-divide ang cell sa skin niya, as you can see, hindi na kayang ma-regenerate and nagkakaroon tayo ng scar. If yung damaged tissue hindi na kaya mag-proliferate or like in Ang's case, sobrang lala yung sira nung stroma na hindi na kayang maibalik yung dating itsura, scarring yung nangyayari. So, how does scarring develop exactly? Anong processes kaya yung involved mula nung na-burn yung mukha ni Zuko hanggang sa naging scar na siya? Okay, well, first, he experienced inflammation. And we have been discussing that for quite some time. So, syempre, hindi ko na pupuntahan yun ulit. Yung new processes na madidiscuss natin dito are actually angiogenesis and remodeling. So, under the influence of growth factors like VEGF or vascular endothelial growth factor, as the name suggests, endothelial cells will start proliferating along with pericytes para makagawa ng bagong blood vessels, which are these ones, galing sa blood vessels na meron ka na originally. So, yun yung tinatawag na angiogenesis. Then, fibroblasts will also start migrating towards the area para maglatag ng loose connective tissue doon until such time na mag-form ka ng granulation tissue. So, word of caution lang, this is different from a granuloma. Ang granulation tissue, it contains capillaries, macrophages, and fibroblasts embedded within loose connective tissue. Yung loose connective tissue na to ay galing ulit sa fibroblasts na nag-migrate towards the area. So, ito yan, mga fibroblasts na yan. Charan! On the other hand, ang granuloma, meron siyang epithelioid macrophages, giant cells, lymphocytes, and fibroblasts na nakasurround sa injurious agent. So, ang intention kasi ng granulation tissue is para mapunan or ma-fill in yung site of injury. Ang granuloma naman, ang intention niya, as mentioned kanina, ay ma-contain yung injurious agent. Okay? And then, eventually, mas dadami na yung collagen within the granulation tissue and magiging scar na siya, which is essentially the process of remodeling. So let's talk about wound healing naman, which is a clinically significant type of tissue repair. So for injuries na onti lang naman yung nawalang tissue, walang infection, and na-close ng maayos yung edges na, primary intention or sa book, first intention, ang mechanism of repair na natitrigger. So with the help of the coagulation pathway, mabubuo itong fibrin clot to close the wound. Tapos itong mga neutrophils na to and later on, macrophages will migrate para ma-clear yung injurious agents. Then, yung normal scarring mechanism will follow until mabuo yung scar na covered by a normal epidermis. Yan. Pero in case naman na yung injuries mo are severe and deeper, as you can see, ito, mas malaking area yung sakop ng wound niya. In that case, secondary intention or sa Robbins, second intention ang mangyayari. Essentially naman, same lang naman yung process, pero syempre dito, mas maraming fibrin ang kailangan and mas malaking granulation tissue ang mabubuo. Ayan. Tapos, ang important difference actually between the primary and secondary intention is the presence of myofibroblasts dito sa connective tissue mo. Kasi in injuries na kasing laki nung mga kailangan ng secondary intention, they actually have to shrink the area of injury para completely masara yung wound. So, I have also listed here yung important factors that influence tissue repair. So we have mechanical factors, infection, diabetes, compromised blood supply, etc. Okay, last but not the least, let's look at the abnormalities in tissue repair na maaaring mangyari kasi may problema sa components or sa process ng repair. If kulang ang granulation tissue or scar na nagawa, we get these parang open wounds called ulcers. If sobra naman yung collagen na na-deposit ng fibroblasts, we get hypertrophic scars and keloids. Ang difference sila is hypertrophic scars are within the boundaries of the wound, ayan, as you can see. Whereas yung keloid naman ay lumalagpas sa boundaries. And of course, yung fibers ng hypertrophic scars mo ay makita mo parallel siya dun sa skin surface, while yung fibers ng keloid mo ay oriented in different directions. Then, if sobra-sobra naman yung granulation tissue mo, proud flesh ang kalalabasan yan. Ayan, kita nyo yung blood vessels na yun. Also, it's also possible na exaggerated din yung pag-contract ng myofibroblasts like we saw here dun sa wound mo, kaya nagkakaroon ka ng contractures or deformities sa wound mo. And ayun, that's it for inflammation and repair na lecture. Thank you so much guys for listening, and inom muna kayong tubig, mag-unat-unat, ganyan, tulog, char, timpla ng kape, para maging ready naman para sa next nating episode. Thank you so much. Woo!